Welcome to the On Your Mind podcast, where we are changing the mental health narrative, bringing hope and solutions. Here's your host, Timothy J. Hayes, psychologist.
Roger K. McFillin is a board-certified clinical psychologist who serves as the executive director at the Center for Integrated Behavioral Health in Bethlehem, Pennsylvania, and he is the founder of the nonprofit Conscious Clinician Collective. He hosts the Radically Genuine podcast, which has soared into the top 1% of global downloads and reached the top of the Apple podcast charts, while also sharing his insights through regular writings on Substack. He is one of the more vocal critics of the psychiatric diagnostic system, the harms of psychiatric drugs, and the standard mental health care of our day. Roger, thank you for joining us. Dr. McFillin, it's a pleasure to have you on the show.
It's an honor to be here. Thanks for inviting me.
I'm hoping you could get us started by telling us a little bit about how you got into the work you're doing and what drives your passion for it.
Well, it's a good question. I get that question a lot. You know, one of the questions I ask anyone who comes and sees me as a client, the one that I most frequently get is, why are you a psychologist? Why do you do what you do? And the interesting story is I didn't really have that intention going into undergraduate school. I thought I was going to be a teacher, football coach. I played small college football. The way that I saw a career was basically what I was exposed to growing up and what was important to me. So I really did have that intention of being a teacher and a high school football coach. And I realized my passion started shifting as I started getting older. My junior, senior year, I decided not to go the route of being a teacher. Instead, I took a job. First job out of undergrad was at a children's psychiatric hospital, ages 5 to 10. And it was my first exposure to what I guess we say is standard mental health care in the United States and probably Western cultures. And it was an inpatient psychiatric hospital setting where you saw kids, obviously that young, were acting out usually violently, aggressively, and it's certainly not developmentally normal for a kid to say they want to kill themselves, but those were some of the situations that would necessitate a hospitalization at that time. I would say most, if not all, of the kids came from violent, abusive backgrounds, crime-ridden communities. And so I saw the psychiatric response to such problems. And this was in the late 90s, year 2000. And so it was kind of almost the height of this revolution of mental illness being a brain disorder with the proliferation of psychiatric drugs used to treat them. So I saw the mass experimentation on young children, and it was frightening to me. I would see kids being really sedated as a way of managing behavior. They were sleeping 16 hours. I saw the side effects of such drugs like tardive dyskinesia, worsening mood, worsening behavioral problems. And I just saw the limitation of what the healthcare profession had in response to such events. And I've always been somebody who questioned authority. That's probably been part of my personality and my soul. And I was pretty effective at what I did as far as at that young age, being able to kind of manage a unit with kind of compassion and respect. And so there were a number of things that I outwardly refused to do that were part of the standard response in a hospital setting. One of them were to put young children into holds physically, sometimes even strapping them to a board. We'd have this timeout room, which you'd have to leave the unit if they were aggressive. And you take them off the unit into a room where they're supposed to calm down. Inevitably, they would almost always become physical with you. And I was always instructed that was a time where I had to put them in physical restraints. And I just refused to do that because they're so small. I was 22 years old at the time. And I used to just say things like to the kids, I'm not going to hurt you. And if we can calm down, we'll return. And it was things like that where you'd see kids respond. It's like sometimes the first situation that they were provided that was kind of loving and compassionate, almost always anticipating physical danger or physical threat. And I saw, how the emperor really had no clothes. I attended treatment team meetings with psychiatrists, and I would ask questions about the diagnosis, or how they obtain this, or what is the efficacy behind some of these drugs. I see them worsening. We're returning them right back to the environment that they came from, traumatic environments. What do you expect a pill to do? I asked all those questions, and really that was the beginning of my step into the field. I wanted to learn more. I felt impassioned to try to understand, how do people live a life well? How do people live life even going through traumatic experiences? I'm interested in human behavior. Most importantly, how do people respond to adverse events? What makes life worth living? And it's been a path for me, from working in multiple settings. We talked earlier last week. I was a juvenile probation officer at one time. I worked in schools. Of course, my training took me to in-home therapies, um, uh, community-based clinics, all the way up to like starting a large center, which I have now. But the passion for it is always about trying to help someone, create a life of value and purpose, even in response to like some horrific events, and being, I think, academically and even spiritually just interested in just human potential, and what we can get out of this life. And that's brought me to this place as a psychologist.
Excellent. I think about what you're doing with your platform and how valuable it is, because unless we're taught these things, we can't know them, right? We don't, it's rare that someone like you stumbles across it. Mostly people are in those programs. Was it Eric Mazello who was talking about how he was shocked at how people just sat in those classes and didn't question and didn't push back? That's what most of us do. We look to the experts and we take what they say as gospel, and then we fill our toolbox with whatever they've taught us. And what you're doing with the Radically Genuine podcast and the hosts you're having on it, I think is so valuable, because it's putting out another, an entirely different, broader, deeper perspective on what is possible beyond just, here's a list of meds and here's a list of symptoms, let's cross match them.
Yeah, it's interesting. Public education, at the very least in the United States, as well as what I have found to be even the academic level at the undergrad, bachelor level, and postgraduate level, doesn't necessarily teach critical thinking. In a lot of ways, like the existing paradigm in education is deference to authority, rote memorization of learning, and regurgitating back what an authority figure tells us. And that has certainly had a powerful impact on American society and American culture, because it gets to the point where there is such deference to authority that you suspend critical analysis even when you're faced with a reality that tells you something different. And we do need those experiences that really do create a shift in consciousness and a shift in perspective, and in the willingness to ask questions. I think that's the hardest part that I find with most professionals in mental health, is that they're generally really kind, compassionate people who want to help, but they're not necessarily ones that are willing to enter into conflict or ruffle feathers. And sometimes that's needed in a field for a paradigm shift. You accept that the authority figure, whether it's the medical authority or that in psychotherapy, is strongly positioned in a way that has certain values that we ascribe to, and a high level of ethics. And that's not necessarily the case when you understand how there are so many competing financial interests that are at play in order to influence us at all times. And that's really powerful in education. You see the pharmaceutical companies, for example, really align themselves with mainstream psychiatry and the medical establishment. So great examples of this is they would hire the most esteemed academics in their field from the academic institutions that many of us would look up to as being some of the best in the world, Ivy League and so forth. And they would hire them as thought leaders. When they would conduct their clinical trials, they would hire them to ghostwrite papers. They would pay them to basically sell the drugs out at major conferences and continuing education seminars. They'd write the books. And then that gets published in medical curriculum, and it becomes fact without question. And so the entire idea of like what is evidence-based mental health treatment is a lot more of a marketing propaganda than it is anything in actual reality. I mean, it's something that's been propped up and created to serve a sick care system, which is the American healthcare system, and it's proliferated across the Western world. And when you look at countries across the globe, when we outsource our idea of what the American psyche is, our idea of what is mental illness, you see just a rapid increase in their identification with mental illness and doing worse, because really it's a culturally constructed idea, mental illness, and we've pushed it into our healthcare settings as a way of viewing it as something that can be treated like tuberculosis or some other medical condition. That we see it as a descriptive symptoms, and those symptoms get in the way of functioning, and then we use various either psychological techniques or pharmaceutical interventions to try to quote unquote decrease symptoms. And it's been such a mass brainwashing campaign. I really do see it as a crime against humanity at this point, because, the outcomes are quite frightening. All you do is increase the number of people who identify themselves as being mentally ill. And we're at a place in history where more people are miserable than at any point in recorded history, despite the wealth that exists in our country. So we have to be asking questions.
Well, and the idea that we were on a path, they were thinking, well, what if anxiety and depression are the result of a chemical imbalance, just like insulin, a lack of insulin production leads to diabetes, et cetera. That's a wonderful thing to explore. The problem is, as you just mentioned, there was so much money behind finding it to be this way that when the evidence goes in that direction, we don't hear about it.
Yeah.
And when they have to create, and they do, and they manipulate numbers and create studies that prove their point, and they don't really prove their point at all. They had to fudge the numbers, but then they get to publish it because they're in that system, and then the general population hears that as though this is the science.
Yeah. What's fascinating for me when I started looking into the trials was something that we rarely ever talk about, was how strong the placebo response was in those trials. That whether it's mental health or pain, you see a lot of people get better from a inert substance, a dummy pill, which provides me a lot of information about the power of consciousness and the power of the mind. And that's some of the most difficult thing for the drug companies to be able to get their drug to market. Is very early on, they were having a hard time being able to outperform placebo, despite the fact that it's very clear that the drug itself, it has psychoactive substances. So most people who were taking it knew they were taking it. So that automatically provides a benefit in placebo-controlled trials, because it becomes an active placebo and you break blind in these trials. But what's fascinating to me is that when people, adopted the idea that they had a medical condition that can be cured with a pill, that even if they were given the placebo, there was some dramatic improvements. So much so that the drug companies had to do very interesting, games in order to approve their drugs. One of them was what's called placebo washing. They would do an initial trial with just a placebo, and then those who responded high to the placebo, they just pull them out of the trial. The ones that did not, they'd compare them to their drug to be able to create some statistical significance, some difference between the two groups. And I think what's really important for the general public to know is that even with that, the drugs really have very small benefits in comparison to placebo. Nothing that you and I, Tim, who do work clinically, would say has any clinical relevance. So it's really interesting to see from a marketing standpoint how those ideas of the drug companies have overtaken an entire culture. And then I start thinking about consciousness. Okay, what are the detrimental effects of kind of viewing your internal experience as something that is outside of your control? like a chemical imbalance or something that is genetic. Like, what's the downstream effects of that type of consciousness implemented into society? And it's powerful. It's very consequential because, we can think about this. If we're looking for a paradigm shift, there's multiple ways that we can understand, let's just say depression, for example. Um, if we view depression as something transformative, as a period in your life where, although painful, although possibly even suffering, that experience is designed to serve you, that it is an indication that there are things in your life that you have to face, and that things have to change. Maybe you have to get out of a horrible relationship. Maybe you have to make some changes in career or within friendships or purpose. It can drive a deep introspection that is really designed to serve us. You compare that to communicating it as it's an illness outside of your control, and the response to that is quite different. If it's transformative, it's normalizing, it's accepting, which decreases the judgment of it. Now you're looking for ways to face your life and to improve your life. And you can actually potentially look back and say, without going through that time, I wouldn't be here today. Instead, we're driving people to extremely harmful drugs, drugs that have significant adverse effects where people are not provided informed consent. They're sold the idea that this is correcting something that is, imbalanced, or there is something that is like a disease state of the mind in some respect, which is false, which is a lie. We're unaware of what are the really downstream consequences of taking a pill that disrupts natural functioning, natural biological functioning of the brain, an organ that we still know little about. You talk to a neuroscientist and you say, on a scale of 1 to 10, 10 being we know exactly about the brain, we know everything about it, how it operates, how it creates consciousness. We know so much about it, with a 1 being we know nothing at all. It's just this mysterious organ that we're just trying to figure out. Most honest neuroscientists will tell you we know very little, maybe a 2 or a 3. But where we are in society is that we act as something. We pretend, we create the
we know all
illusion
this stuff.
that we know these things. And unfortunately, that's where the general public is really just lied to. They're lied to on so many fronts. And I think we have a responsibility, as those who are kind of speaking out against this and have put the work into it, just to be honest. And I mean, that's all I'm asking for is that we're honest and informed consent is provided. And for those medical professionals or therapists or those in the mental health field, is to awaken them and to enlighten them on what has happened in the past 35 to 40 years that has put us in this horrible position, and not to just continue to do the same thing over and over again, despite the horrific results, and to start thinking critically, really start thinking critically, ask the very important questions, and make sure that those you serve, that we really make an oath to do no harm, to work in their best interests, that we can be transparent with what we do know and what we don't know.
Well, to back up just a little bit to the idea of the placebo effect, when you tune into people that study it, have you heard about the book Suggestible You by Eric Vance?
I have not.
It's he pleads the case that it's entirely possible that the vast majority of benefit we get from any drug we take is placebo effect. Yeah. And how will you ever tease that out? We may never tease it out, because we've come to think, here's the doctor, here, MD stands for minor deity, right? The God is going to tell me what I need to do to get better. And it's so pervasive that to this day, when I talk to people, just friends and other people I know that are in the medical profession, they sound astounded to run into a situation where the doctor doesn't have it all pegged down. Here's the problem, here's the cure, here's the, well, what do you mean they haven't been able to fix your XYZ? And they're operating from this cultural bias that says, yeah, the doctors know. And so many times, whether it's the physical or the mental, emotional, they're guessing and they're throwing their best guess at it. They're doing this somewhat educated trial and error technique. If they're really good, they're really doing a trial and error. They're paying attention to the errors and using it as feedback. But for the most part, the power of, I think it was Bruce Lipton who said, let's quit talking about it as placebo effect. Let's call it the belief effect, something with some reverence, something that acknowledges it, that if I truly believe in something, it has much more potential to actualize in my life than if I don't.
Yeah. I mean, fascinating. I read this book called Surgery, the Ultimate Placebo by Ian Harris. He's an orthopedic surgeon out of Australia. And I ended up interviewing him on my podcast because I've, expanded my, interest in this phenomenon. And, he makes the case empirically that many of the common surgeries that we undergo are nothing more than placebo. And there's been placebo trials for like knee surgeries, arthroscopic knee surgeries, where you'll wheel people into the operating room and they won't know if they're getting the surgery or not. They'll make an incision for a group that they'll do the surgery, another group they won't, and they don't really find any differences.
And they'll keep them in there the same length of time, and they'll make all the same noises and have all the same conversations. And in the book with Eric Vance, he talks about there was Parkinson's was a big issue, and they had a new medication for the Parkinson's. They thought, we're going to put this in a double-blind trial, and in this particular medication for the Parkinson's, they had to drill a hole in the skull and inject it into a specific part of the brain. And so they did all of that, including putting a little divot in the bone so that when they stitched it back up, people couldn't tell if they'd had it or not. So this is one of those where you're really kind of pushing the limits about, could there be a placebo effect for the drug? No, because the vast majority of people that they found, not the vast majority, but what they found was the people in the placebo effect had more negative side effects than the people who actually received the medication.
Yeah. I mean, it's absolutely fascinating.
And the reason he cites the study is that there was a gentleman in the study who was essentially cured. And he was at the point where he couldn't, run or play ball with his sons or whatever. And he was so excited, and the doctor was excited because he and the doctor thought, that's it. They found a good solution for Parkinson's. And the way the studies are run, at the end of the study, they have to let everybody know, did you get the placebo or did you get the treatment? And if the treatment was worth doing, they had to offer it to the people. He was a placebo. He had this seemingly miraculous cure just because he thought he'd gotten the medication.
Yeah. Yeah, I mean, it's powerful. And one of my concerns is we're at an era right now where there's so many people self-diagnosing with psychiatric conditions. I can go back to when I was in school. You had to learn the DSM. It had to be taught to you. Nowadays, you have exposure to these pseudoscientific labels through TikTok and social media and YouTube, and so many people push it out there. At my center here, we have an intake coordinator who does initial phone screening interview for all clients who are trying to come in here. And there was a time where people would call in and say, I'm struggling with this, or I'm feeling this, and I want to talk about this, or I want to face this. Now people just call up and say, I have bipolar disorder, ADHD, major depressive disorder. Like, they just list out these diagnoses. Yeah. And I'm seeing the same thing when I'm starting clinical interviews. Like, it's almost like they're prepared just to describe their DSM diagnosis when I'm interested in learning about them. When I say, well, that tells me nothing about you, I want to learn about you. It's almost like there's a little bit of a shock. Because they're just so used to reporting symptoms as experiences in our general medical system. And I worry about what that has done as far as an identification with disease and identification with being broken and the impact it has on them. It becomes a self-fulfilling prophecy if we're going to use kind of this the science around placebo or the expectancy effects, you start creating a consciousness about who you are. And I think that's felt at every cell in your body, and it commands your attention. It commands what you focus on and what you don't focus on. And then what are the powerful consequences of creating that sick idea that gets then reinforced in our society, sometimes in very unhelpful and negative ways? I never thought I would come to a time where, people are offended if you don't want to speak in terms of, psychiatric diagnoses. It's like they've adopted that as part of their mentality and even a personality around it. And so when we think about consciousness and we think about, the power of the mind as a healing mechanism, or the power in the mind as a creator, one of the areas that I've now kind of evolved to in my work as a clinical psychologist doing therapy is I want my clients to be able to observe what they are creating, to see themselves as a creator, that their mind, their consciousness is playing things out in their life exactly as they see it, and to not feel so powerless in that process. And that's that's a shift away from, I think, what is typical mental health care, where people are coming in, they're getting these therapies, they're being validated and affirmed for these diagnoses, and they're measuring their success in terms of like feeling less anxiety or not feeling anything at all in cases like that. And when we flip the script a little bit and we talk about our emotions as something that is, they're powerful, all of them. They work in concert with each other. And to think about that, dialectical balance between the dark and the light in so many ways, and how they inform, the rich tapestry of all emotions, like inform our meaning and purpose in this world. And all of them can be used to benefit us in some way. It's a new concept because that's not how we're conditioned in American society. It's not what people hear in school. It's not what people are going to hear on social media, in TV, and movies. And it's certainly not what most mental health professionals are being taught right now in their master's program or their doctoral programs. In fact, it seems to me, Tim, and I want to get your thoughts on this, that we're actually just like training therapists to be part of this fast food style of healthcare, like almost to be working on an assembly line, to get as many people in as possible, give them the diagnosis, refer them off to a medical professional, and try to combine some basic talk therapy with drugs.
I would have to agree based on what I hear from people. And I was privileged to interview Dr. Jod Skillcorn, and she came out from her medical program with her residency in psychiatry and started practicing just what they taught her to do. And then somebody gave her Roger Whittaker's book, Mad in America, or Anatomy of an Epidemic. I forget which one she read first. And her eyes were wide open, and she said, "Oh my God, why didn't they tell me all of this about the research that's been done and the body of work that demonstrates that it's unethical for me," in her view, to just prescribe medication and not help people understand the inner workings. And she had to go back and get retrained in, functional and integrative medicine or practices and therapeutic practices. So she felt like she had something of value to offer her clients, patients. And if my job for decades now in therapy, I've said to people, I believe the purpose for your coming into therapy is for you to learn more about how you work, what motivates you, what makes you tick, what gets you happy, sad, frustrated, stuck. Because the more you know about that, the better equipped you're going to be to make the decisions that only you can make in your life. And that's been the guideline that I've used for everybody who comes to see me for therapy. How can we help them understand what they have some locus of control over in their own lives that can change their actual experience of life day to day? And yet, time and again, I run into what you're talking about, people who are just out of school and all they want to talk about is the list of descriptors and labels and how they can, tell you what pathology you have and or plug that into some technique they learned. And it isn't effective as far as I've understood in my career. It just doesn't produce good, lasting results. It does produce people who are trained to go to a therapist every time there's a problem. It doesn't really produce people who know how their own mind body energy system works and how to use that locus of control in their best interests.
Yeah, it's almost a revolutionary act right now to be able to communicate to somebody that they have it within them to overcome whatever is placed in front of them. You know, there's so much dependence that we're creating on a professional, on an expert. We have this expert culture in the United States where, you know, at this point, parenting, you know, we're at a place where, you know, there's so many parents who question on how they should respond to their own kids because there's so many competing information, all these different theories, all these different ideas. Something that, you know, this is, in my opinion, it's innate, it's within you. Love your child. I mean, you're not going to be perfect. There is no perfect parent, there's no perfect person. But being able to just love your child, to discipline your child when you need to discipline them, to consider who they are going to be as functioning adults, and to be able to respond accordingly at different times in their life, to be a guide, to be there for them. You don't have to go and you know, read the next book or search the new uh, whatever the new theory is, gentle parenting, and other times there's been, you know, more behavioral parenting, and it just shifts in your culture, whatever the new thing. And I think the bottom line is people are kind of taught not to trust their own intuition anymore. They're taught to have to get these things confirmed by another professional, and unfortunately, the professionals are kind of taught to have to know it all. Um, you know,
Well,
and
and they're taught the stuff that doesn't really work, right? They're taught a party line of here's here's what we do in our profession to make sure that we're locked in as seen as the experts, so that people come to us and pay us money. It's not necessarily what we're taught the things to do to help people make a healthy, loving, productive life for themselves.
yeah, I mean, the idea of what is a healer? You know, I think we can go back centuries, almost to the dawn of like tribalism and dawn of man. Is that, you know, communities always had, you know, people within that community who were viewed as healers in various ways, and we see that cross culture right now in indigenous cultures and so forth. You know, what are some of the common themes of that? You know, to heal is to be connected to nature. To heal is to be connected to your ancestors, to something much bigger than you. To heal is to be given time, to be able to work through challenges, to see life as a journey in that way. To
To have a
heal is
sense
to
of purpose in your life.
a purpose, meaning, to be very mindful of what goes into your body, you know, in your health. And instead, I think we're training, people to like dispense advice. We're training people to dispense drugs, to dispense diagnoses, all which have a extreme uh, consequence on, you know, how that developing person views themselves. And that's where I think we have to be much more mindful and much more ethical as the therapist, as the psychologist, the counselor, the social worker, is what are you colluding with when you enter into a relationship with a client who's suffering? What are the two of you creating in consciousness? What is the idea of who they are? What and how is that being influenced by American culture and the American medical system? Right. And so I don't know if that's taught. You know, those things are not necessarily taught in graduate school. In
Well,
fact,
but pretty much the opposite of it is taught. I was just going to say, as you took a pause earlier, I remember being in graduate school and smack up against the reality that I'm supposed to go out and teach people how to live a healthy, balanced life. And I am doing 16 hours of graduate school credits, plus a practicum, plus working 3 jobs, trying to get the money together. If I'm not sleeping or eating, I'm studying or I'm doing therapy with somebody. The idiocy that I'm going to teach people how to live a healthy, balanced life when mine is falling apart. And the system that's set up for that I had a professor in graduate school said that he was in, I forget which, it was Northwestern Chicago school, and when he was in grad school, they got commissioned to do a study to find out why doctors were such rotten people. And they
Mm.
went back and did the longitudinal study and interviewed people from their kindergarten years on all the way through. And the solution to or the answer to the question was it was happening in medical school. They had wealth, well balanced, healthy people who wanted to go be doctors, and they put them into this crush of pressure and lack of sleep and financial pressure and mental emotional abuse and late nights and early mornings, and they came out angry, bitter, hurtful,
Yeah.
resentful people.
Yeah, it
So
serves industry, serves a system, a capitalistic system in the United States where we are kind of cogs in a greater, workforce, and we're kind of trained that way from the beginning. Medical professionals in itself too. I mean, they're some of the best and the brightest, but what they tend to be really good at is understanding the information that's presented to them and being able to regurgitate it back in a way that can provide them really high scores. And maybe that's in math and science. Um, but then you go out and you serve that same system. I mean, when you become a physician, you are putting yourself into pretty significant debt, and then you have to work those long residency hours, do a fellowship, all those things afterwards before you even get into the system, and then you're tied to it because of the amount of money that you're in debt. So, whether you agree with some of the recommendations that are being placed out, the protocols that are being used, you certainly don't have time for your own independent research, not when you're a practicing physician. You're following industry developed guidelines that are pushed by the pharmaceutical companies who fund these major medical organizations. I had an interesting conversation with a pediatrician not too long ago, because what I did is I ended up looking into the American Academy of Pediatrics guidelines for depression, because my understanding of the literature on antidepressants for youth is this. It's a harmful intervention. Yes, we do have a black box warning on that. Everyone knows that it's at least a double the rate of suicide compared to the placebo groups. But in my investigation, it's about 4 to 6 times greater. It's a dangerous intervention. We don't have a lot of supportive research that it's effective in any way. And of course, we've kind of had to create this idea of what depression is, and then we apply it to young people, which it never fits, almost never fits the definition that we try to define as what is clinically depressed. So we know it's a harmful intervention. And I asked doctors, because I think 80% of these drugs are now prescribed in primary care. I asked this gentleman who was kind of pushing back a little bit on some of the things I've been saying. And I told him, I said, you don't want to get in this debate with me. I got obsessive about this literature. You're not going to really be able to find any good supportive clinical trials that say these drugs actually relieve this, what we call the symptoms of clinical depression in youth. In fact, they're quite dangerous. They end up becoming a gateway to many other psychiatric drugs, the label that we place upon them. And eventually kind of settled down, and he started asking me questions. And then he said, what am I supposed to do? I want you to put yourself in my shoes.
yeah,
I have an adolescent who's brought in by their parents, and that kid is saying that they hate their life or they want to kill themselves and things of that nature. Outside of like an immediate hospitalization, which you don't want to do, but you're finding like that's what they are doing. They're going right into a hospital when everyone makes that statements because of the danger associated with it. But they have these guidelines that say an antidepressant is as effective as any other intervention and should be a frontline intervention for youth. So I looked into all that data. It was clearly small cherry-picked studies. Yeah. The primary studies, the most important ones that exist in our field, and there's not many, but when we do study these things in youth, we see that there was a lot of problems with research design. There was misrepresentation of the data. We know there's great harms. Why would we be giving a drug that increases the likelihood of suicide to a suicidal teen? It makes no sense. And he says, I have to follow these guidelines because imagine if I don't. Imagine that something does happen to this teen I am the one who is going to be held accountable because I am acting outside of what the guidelines tell me to do. I'd love to send them to someone like you, Roger. And so you can do the evaluation, you can make the recommendations. I'm not an expert in mental health, but I am forced to have to follow my guidelines. And that's a system that we are currently working in, that these doctors, even if they agree with us, even if they have concerns, right? Um, they have to follow exactly what those guidelines are. They're working in large care hospital based systems at this point because the Affordable Care Act has really ruined the independent doctor. There's not many of them. And if you are kind of stuck with all these student loan debts, it's not like you can say, I'm going to leave the system and start something new, not with all the restrictions that are placed on doctors nowadays. So it really is a broken system, Tim. And the only way out of it is if we educate each other and we resist some of what is going on in the medical care system.
Well, and again, back to the issue of if you're not taught about it, you can't do anything about it. Nadine Burke-Harris in her book, The Deepest Well, another example of a medical doctor who gets through training and goes out to practice and has never heard about the ACEs study. She just had, it had happened, 10 years earlier, it had been published, and she's in doctorate school, and this research is out there, and they never talked about it. She was never exposed to it all through her training. And then she gets out there in private practice, and somebody comes along and says, have you ever considered that trauma in childhood might have an impact on the person as a child and as they develop and as an adult? And here's some amazing correlations, high correlations between the number of adverse childhood events you have and your physical mental and emotional problems in adulthood. And she was blown away to the point where it prompted her to write the book.
Yeah, and it's such common sense too, right? I mean, to say that our experiences in our life and how we're treated, how we're treated by our families, how we're treated in our communities, what we put into our body has a primary impact on how we start to develop and feel as an adult, right? Meets every simple logical understanding of human development, right?
And yet there have been people with degrees and titles after their name that say that's all hooey.
Yeah, I mean,
they held sway for, I don't know, at least a couple decades in my career. The Skinner, the black box business, it doesn't matter what's going on in there. You provide the right rewards and punishments and everything will be fine.
Yeah, I mean, it's really enticing and to kind of reduce the complexity of the human experience to things that are simple, and you can see how that can be sold to people. If I do these simple things, if I can understand the complexity of all human behavior through these things, the reduction of like something as meaningful and complex as like a depressive episode to a chemical imbalance, or to understand behavior simply in terms of reinforcers or punishers. Like there's something that's really, I understand it's attractive to that because it's like it gives us like a set of understandings and ways to respond that are rather clear and rather simple. Unfortunately, that's not what human beings are. Life is messy. Obviously, as we all know, we're so tied to the culture in which we are raised in, and the rules and the mores and everything about that time, and how suggestible we are to the information that's being provided to us, whether it's government, whether it's media, social media, our teachers in school. All of those do have a pretty profound impact on us. I think one of the things is that we haven't yet to realize as human beings is what our potential really can be. I mean, what we create in consciousness is what we play out in behavior. I mean, I think that we're going to evolve to a time where there's no war because we don't hold it in consciousness, where there is no sickness because we don't hold it in consciousness. But we are in a culture that is it is aggressive, and media gets more eyes when there's fear. This fear-based culture drives our attentional processes because we still have a very limited biological survival-based mind. And so, yes, it's going to grab our attention. Anything that provokes emotion strongly, especially that of fear, and trying to transcend from fear into more love-based state is, I think, one of the primary purposes of this life. Many don't do it or are unable to do it. They feel consumed and overwhelmed by fear and live that out. But I think if we're going to evolve as humans, if our cultures are going to improve, or we're going to decrease illness and war and violence, we have to learn to be able to transcend that feeling of fear. I mean, how many of your clients come into you to work with you somewhere on the spectrum they're dealing with intense fear, and that's a primary reason that they're struggling.
Well, or they had to overcome incredible fear just to make the call to come in because of the stigma, etc. And, you know, we've talked about some of the problems, and, just matching a medication with symptoms is a problem. And the whole idea of pathologizing ourselves and what the functioning that we have is a problem. What kind of solutions are you finding work best in your practice?
Yeah, it's interesting. I have a fairly large group practice that is also a training clinic. So we train doctor level students who are doing their externships, as well as what's called licensed associate professional counselors who are working towards uh, achieving their license to practice independently as a counselor. And we're part of what's called a non-pathologizing movement, that we want our clients and the people we serve to be able to understand their emotional reactions as gifts. Um, whether that, depending on what your perspective is, either a gift from God or just evolutionarily, it's designed to serve us. So to automatically take that non-judgmental, accept-a-space approach of emotions has, I think, pretty profound positive outcomes, right? When you don't judge your experience internally, there's a number of things that don't happen. One, they don't demand your attention and your focus. So the more we focus on how we're feeling, the worse we're going to feel. When we accept all our emotional states, even thoughts, as something that we can observe without judgment, we decrease the intensity of those emotions. And then where do we want to focus our attention? We want to focus our attention, similar to kind of some of the things you were saying before, to understand themselves, to face and solve problems. When you take away the pathology of the individual, and they understand that even problem reactions or behaviors. I mean, I work with people who have eating disorders, who might self-injure, who might be abusing substances. We understand that those behaviors in context are used to try to change the way that they're feeling, for the most part, right? And so when you work with somebody to give that up, to not change the way that they're feeling, instead, but to accept them and understand them again as tools or gifts to serve them, what you do is you increase your tolerance and acceptance of those states, and you focus your work with those clients on creating a life that's worth living, one that's of value. And it's amazing to me what happens when someone begins to shift their consciousness in their life about how they want to live it out. Now that can be in conflict with other approaches in therapy, where the therapist really gets their clients to focus on their childhood pains or their traumas or everything that's wrong in their life. Personally, in my understanding of the outcome, that has limited effect. Not to say that there's not a time to to validate that or to accept that, or PTSD symptoms are real and people do have to process painful memories and experiences. But not in a way that's being kind of delivered in I think, our healthcare system. I mean, we see people in therapy for years and years under this idea that they've created in their minds about them as either mentally ill or traumatized or so forth. And we don't necessarily kind of approach it that way. Um, we can understand that experience, but the only place that we can live is in the now. And the now is very powerful. As I mentioned before, we can only create in the now. And I want people to be aware of what they are creating in their relationships, in their consciousness, with their behavior. The second piece to, I think, what we're doing really well here at my center is that we understand that we are holistic beings of every sense. So we are in a society right now, American society, where 66% of American adults are suffering from at least one chronic illness. We have 25% of adult females on an antidepressant. I don't even know the whole general, population of people taking at least one psychiatric drug, but every year it seems to increase. We're not doing well mentally. We're not doing well physically. Metabolic illness is a legitimate concern that has psychiatric emotional consequences. So we're also looking at the lifestyles in which people are living. And so we are looking at like nu common nutritional deficiencies that are going to manifest themselves into low mood, fatigue, sleep problems, and anxiety. And we want to do a really good assessments around that and direct people with education in the right direction. We also care very much about how they are moving their bodies and engaging in relationships in their lives, their quality of sleep, their routines. This right here is a phone. The detrimental effects of screen time and social media are quite profound, and we've got really good data to support it. So one of the things that has been part of our evaluation process, we ask them to pull out their phone and to give us some how much time they're on it, and to look at the various social media apps, because that is driving their attention. We know it makes people feel physically ill. We know that it impacts attention, and we certainly know that it has profound effects on esteem and well-being. So we're trying to use all the tools that exist to improve a person's ability to live fully, and then trying to incorporate everything we do know, or that's evolving and developing from our field, to be able to assist people in doing that. I am a behaviorist. I do believe in really trying to change action in order to change our experience. I am somebody who meditates daily. There's a number of things I do that I think provide me profound positive responses in my life. One of them is gratitude practice. The other is exercise along with meditation. And when those things, along with a strong diet and good sleep, when they're not involved in my life, or I'm struggling to get all those things in, I don't feel well emotionally in the same way. And so I think that has to be, if we're going to be part of a healthcare system, and psychologists are part of a healthcare system, we have to be able to integrate into that, and move people away from there's a pill for every ill, or from the sick care mindset, or the diagnosis mindset. And that's where I'm trying to take Center for Integrated Behavioral Health. I'm also trying to do the same thing with my writing on Substack, and as well as the Radically Genuine podcast.
Excellent. Excellent. Well, I realize we're just about at the hour. When people want to reach out to you, how do you prefer they reach out to you?
If you go to drmcfillin.com, that's an easy way to send an email to me. There's one other thing I want to kind of promote, is I just recently started a nonprofit called the Conscious Clinician Collective. And that is, you can find that at thecccollective.org. And it's a nonprofit that's trying to align all ethical mental health professionals who are really concerned about what is happening in our society. There's kind of a war of emotions, the proliferation of psychiatric drugs, the lack of informed consent. And we're trying to, align people who are interested in the same things. I created a declaration. One of the challenges that I received from starting my platform, and it started on social media and with Twitter, and grew that as large as I did, and then the Radically Genuine podcast continued to grow, is people are asking, how can I find someone like you? There's so many ideological and industrial influences that we don't necessarily trust anyone we're talking to. We don't want drugs pushed on us. We're concerned about what might happen to our kids. Do you have any referrals? And so I want to just create this large scale network where people can pop in their locality and find somebody who has joined the Conscious Clinician Collective and been able to kind of attest to the declaration. And so to align us, ethical clinicians who just, care about medical freedom and informed consent first and foremost. I think the long-term goal is to also just provide access to information. We have to trust people to be able to do some of their own research on what is mental health therapies and what is mental health treatment, one of the core features of informed consent is to not only be told kind of the risks and benefits of any intervention, but also alternatives that exist. And so it's trying to access not all mental health professionals, but also those who are in healthcare. There's a lot of doctors who are trying to pull themselves out of the system, go more functional medicine. There's alternative healers, nurse practitioners, naturopaths, number of people who just are trying to support people's health and well-being from multiple perspectives. And the Conscious Clinician Collective is trying to align those people.
Okay, so that's cccollective.org.
thecccollective.org.
Okay.
Yep. And you can go to drmcfillin.com too, where you can access the Radically Genuine podcast. You can email me directly. You can also, check out my Substack. The links are all there. So drmcfillin.com is the easiest place. thecccollective.org is where you want to check out the Conscious Clinician Collective. And we're in a fundraising stage, so we need clinicians to be able to join, so we can build the platform. And anyone, even if it's the cost of a cup of coffee, just to donate to us so we can get this up and running, it would be very much appreciated.
Excellent. Well, I like to make sure that we give you a chance to just get centered and clear your mind and think, is there something that we just talked about in the last hour that I want to go back and highlight, or is there something we skipped over that I didn't mention at all? If you want to throw that in here at the end, what would you like to leave us with?
We touched on a lot of different subjects. One of the things that I try to share on every podcast that I go on is that what we experience internally, and what I mean by that are our emotional states, our thoughts, our memories. It's been hijacked to create an industry and to create a dependence on a sick care system. And everything that we know, I think, about human potential is that each experience, whether painful or whether joyous, is there to serve our transformation. That life is really meaningful for every single person, even when it doesn't feel that way. And where the mental health field, in my opinion, needs to continue to progress to is there has to be a unifying viewpoint about human potential and how resilient we all are in response to the suffering and struggles that exist as part of this lifetime. We talked about trauma, and my perspective in this, after decades of working with traumatized individuals, is that there's some of the most wise people that I've come across in my lifetime. That going through something that's really dark in your life and walking towards the light provides profound insights, and also, if allowed, can allow you to think deeper and love deeper. We don't necessarily, talk about painful events, traumatic situations in terms of like post-traumatic growth in the way that we can. And how are we going to view our collective fields, all those who practice in healthcare and mental health care? Are you going to view yourself as someone who can, support and guide in recovery? Or are you going to view that person as someone who's sick, broken, with a disease to be managed? Just consider the outcomes of each approach and the impact that that's not only going to have on the individual, but our collective culture.
Excellent. Well said. I have a feeling it's not the first time you said that.
Mm-hmm.
Well, I thank you so much for being willing to share with us and for the work you do. It's a pleasure meeting you, and I thoroughly intend to follow your work, and I'll check out the collective.
Right. Yeah, I'd love to have you be a part of it, Tim. And it was an honor to to come onto your platform and to be able to talk to your audience.
Same here. Thank you so much. Roger K. McFillin is a board-certified clinical psychologist who serves as the executive director at the Center for Integrated Behavioral Health in Bethlehem, Pennsylvania, and he is the founder of the nonprofit Conscious Clinician Collective. He hosts the Radically Genuine podcast, which has soared into the top 1% of global downloads and reached the top of the Apple podcast charts, while also sharing his insights through regular writings on Substack. He is one of the more vocal critics of the psychiatric diagnostic system, the harms of psychiatric drugs, and the standard mental health care of our day.
You've been listening to the On Your Mind podcast, offered by Journey's Dream, where we support people through mental health challenges to a place of true and lasting well-being. If you love our show, we invite you to visit onyourmindpodcast.org to join the conversation, access the show notes, and discover our helpful resources. Thank you for listening.